Hello, my name is Gerard Creces and I'm seeking the NDP nomination in Huron-Bruce to run in the October federal election. Now today I'm outside the Seaforth Hospital to talk about drugs, and Canada is the only OEDC country with a universal healthcare system that does not provide universal drug coverage. We're second only to the United States in drug spending. Now drug prices in Canada, they're negotiated separately from province to province, so depending on where you live, you could be paying a lot more. But 10% of Canadians have trouble with their medication costs, and so sometimes that means limited pensions for seniors. In my generation's case, that means low-paying jobs with no benefits, and sometimes it actually just depends on the drugs themselves, and particularly those used to treat rare illnesses. And when people can't afford their drugs, they go without, and that adds massive cost to our healthcare system in the long run. Now the myth is universal drug coverage would drive costs through the roof. Now the reality is a national pharmacare program could actually reduce costs significantly. Canadian Medical Association released findings in their journal this March that uncontrollable costs for national pharmacare, it's a myth. The private sector could potentially save, by their figures, a median of $8.2 billion a year, while the Canadian Federation of Nurses Union actually estimates the savings could be as high as $11.4 billion. It's a negligible cost for the federal government, that $1 billion that they'd have to chip in, considering the long-term savings associated with a healthy population. Now imagine if the Canadian government took it on themselves to become the bulk purchaser of prescription drugs in this country. We'd regulate costs, we could increase competition for pricing, and we could increase public information on drug side effects and clinical trial results. And we could also crack down on misleading advertisements for drugs, and that's something the NDP stands for. Now instead, the Conservatives have been treating healthcare like a money pit rather than an investment. Stephen Harper let the $41 billion Canada Health Accord expire in 2013. And instead promising 6% annual increases up to the year 2017. That's a year and a half away. And after that, transfer dollars would be based on the economy and inflation and not on our actual health costs. That's not a strategy, and it would lead to greater imbalance between provinces and do particular harm to seniors and low-income Canadians. Now, we could be providing access to medication for everyone, but we need the political willpower, and we need a party that focuses on patients and not patents. And I talked about drug patents in my video on the Trans-Pacific Partnership earlier this week, and as it stands, the Harper government would actually be making it easier for drug companies to continue to gouge us, and would continue to do so by extending patents on drugs. Now, generic drugs in some cases are 80% cheaper than their name brand counterparts. So why is our government fighting to protect the most profitable corporations instead of the most vulnerable Canadians? My name is Gerard Creces and I'm seeking the NDP nomination in Huron-Bruce to run in the October federal election. Saying universal drug coverage doesn't work is a bitter pill to swallow. So let's add a spoonful of sugar. Let's take the power back.